First, I'd like to introduce Mike Wall, who is the president and CEO of Northridge Hospital Medical Center in the San Fernando Valley. Mike has come down. Mike's in the middle of all kinds of crazy stuff at Northridge Hospital this week, but he's come down to just share with us this morning. He really was the driving force that made the way with an amazing group of women in Van Nuys to make this center happen, the Valley Cares Family Justice Center. So please welcome Mike Wall to talk a little bit about his perspective.
I think as Casey was talking about leadership, the great American philosopher Yogi Berra came to mind. And that is, if you don't know where you're going, any road will get you there. You know? So I think for me, what got me engaged, and I appreciate Casey's kind remarks, but the reality is there were people like you that had incredible passion, that touched domestic violence every day in your work, who came to me through my community benefit organization. And one of our programs, our CATS program, our Children's Sexual Assault Treatment Program, that sees over 1,000 cases a year. Kathy Adams, who's here, was one of those leaders that came to me and said, Mike, we need to do more. And then with that, I got introduced to the movement, and now I'm a big fan of the movement. And then I really got the opportunity to meet the people that are here today who really make it happen, not me. And that is Detective Angela Romero, Kim Roth, who's the Executive Director with Valley Trauma, and I already mentioned Kathy Adams, and one of our victims. And I think the story that Jennifer told is what motivates people like me, and that's Julie Kunder, who is a victim who is, you know, I met her when we had the opportunity to present to the LA City Council. And she rode along with me, and I heard her story. And last night at dinner, I said, how's it going? And I'm telling you, for me, that's why I do what I do. So what I wanted to share with you is a little different perspective in terms of bringing healthcare to the table. I'm not talking about county healthcare. I'm talking about the private nonprofit sector. How do I do this? What I passed out to you is this SB 697, but you really do want to consider, because everybody needs resources. Don't overlook your community hospital. So how I would, and I think you're going to get different levels from what I understand. So if you're close to launch, boy, you want to really pay attention, and you want to call me, I can be reached at 818-885-5321. Adrian's my assistant, and I'll make whatever time I can available. If you're not close to launch, then put this in your folder, and you'll pull it out someday as a resource set. But what happens is, in the state of California, every community nonprofit hospital through SB 697 must demonstrate why it deserves its tax-exempt status. So every 3 years, a community needs assessment is done. So what you really need to do is understand what's in that document and look for any reference to domestic violence. Or more importantly, find out when is it going to be done and make sure you're at the table to identify domestic violence has a need. Because it is huge in terms of how a hospital goes forward. Something else, and it's always follow the money. Okay. Every community hospital does great work, but there's different levels of performance. So in order for you to do your homework, who should you approach? My counsel to you is go to the Office of Statewide Planning and Development, OSHPD. Pull up the profitability of every one of your community hospitals so that you know, all right, who's got a richer bottom line, who's got a thinner bottom line. If you decide you're going to invite everybody to the party, that's a decision you can, but if you want to be strategic, my counsel to you is pick somebody that's got an incredible bottom line, because that's going to be important. I think you want to review, every community hospital does an annual report. Get your hands on it. they do in the way of community benefit. And again, look for that linkage to domestic violence. All right. When it comes time to make the ask, I'm just telling you in life, it's all about relationships. Take advantage of the people at the table who have the most juice. I don't care if it's title, I don't care if it's the clergy, I don't care if it's the chamber, but what you want to do is make sure you organize your team. You know, the chief of police or the DA, when you go to make the ask, you want the people of influence there. I think there's always a balancing act between not looking at too much where you would bring community board members into the, into that situation, because you don't want to pressure the CEO, man or woman, into thinking, well, it's the leverage from the board. It's the message that you're really delivering. Okay, before I then move to these slides, I think what you need to be prepared for is the CEO is going to tell you, this is really great. You've got your story. I think everything that Casey, others have said, why are we doing this? Why did I do it? Because I realized, just what Casey was saying, is we've got to do something to stop the cycle of violence. And if a woman, primarily women, but it's not restricted to women, go to 32 different agencies to get help. And we've got a national model, and it's making a difference. Why aren't we at the forefront? More importantly, hospitals employ the majority of women. So my staff is 80% women. So if we're looking at the prevalence of domestic violence, it's our workforce. I'm going to deviate. You got my slides. I'm going to deviate, in the slides here. So you've got the CEO, so you're really going, why should I care? You can reference this. What I learned in preparing for this, I should have known this before, but I was already hooked. But what I learned is I talked to my medical director for the emergency department. And I asked him, what do you see through the emergency department? And unfortunately, I learned something I didn't expect. Which actually, we're way too busy. They're seeing 175 visits a day. That's not where meaningful exchange is going to occur. They take care of whatever the patient presents to, and they're done. And there's not a meaningful conversation. So you can't use the emergency department with the CEO to help them. We have a behavioral health team. Talk to the director there. He says, Mike, we're dealing with acute short-term hospitalization. We can't deal with it there. We deal with it in our partial program. But where we really see it is our maternal and child care in the OB department. And in your slides, there's plenty of statistics I pulled from some articles that my director gave. So you want to use that. Now, so you've got a predominantly female employee staff. You've got a healthcare issue, particularly around women who present for OB services. Now, be prepared. CEO is going to tell you, well, I really like everything I hear, but you have to understand, we're in the midst of healthcare reform. And I'm going to have to lower my cost for Medicare by 20 to 25% over the next couple of years. And the 32 million people who are going to come into an insurance pool, those individuals are going to be under a Medi-Cal or a Medicaid program, and that's not the best reimbursement. So I'm going to have all the pressure on my shoulders. You want to change the conversation. Conversation is currently, we're reimbursed by unit of service for the most part. This is what we do, we get paid. Healthcare reform is moving towards episodes of care, a bundled payment, or the risk of saying we have to take care of the entire care. So the article that Kathy Adams gave me, which is Hidden Cost in Healthcare, the Academy of Violence and Abuse, the experts will know how to get that to you. It was written in 2009. You're able to use that with leadership and say, where healthcare is going is into these new accountable care organizations. And when it does, we're no longer going to pay for fee for service. So an enlightened CEO will start to see, okay, I can't use that. This is a way to reduce healthcare costs. It's a way to provide treatment programs, stop the cycle of violence, and really reduce the cost of healthcare. So that's kind of my message, and why I came down today, because I am hooked. You know, I'm hooked by people that are at this table that have passion beyond belief. I feel blessed because as a CEO, what we have is control over a lot of assets. How do we use those assets to improve the health of the community? And those are decisions we make every day, whether it's cancer prevention, heart prevention, but domestic violence isn't on people's radar screens for what I do. And I think with you and your leadership, take advantage of your local community hospital. Many of them are extremely profitable, and they should be investing some of their money in community benefit. That's why you have SB 697 in front of you. So Casey, I think here, if there's anything else I can do to help, you know I'm here for you guys. I've been to a couple of the annual meetings. I learned more. I think your little exercises about relationships and networking is so critical because we're all in this together. And I'll tell you, I'll end with surround yourself with good people and great things will happen. Thank you.